Ever feel like healthcare policy is this like distant thing?
Yeah.
Something that doesn't really impact you?
Yeah.
Well,
I think a lot of people feel that way.
a lot of people do. And recent shifts stemming from some of the new executive orders are reversing some Biden-era initiatives.
Right.
And this could actually change that.
Yeah.
We're talking about potential changes to access and affordability for millions of people, and not just folks who are directly on programs like Medicaid or the ACA.
Yeah.
The ripple effects of all this could reach a lot further than you think.
It's a pretty significant, if you think about it, we're talking about a pendulum swing.
Right.
We saw record ACA enrollment under the Biden administration.
Right.
And that was partly due to the extended sign-up periods and the increased subsidies that were offered.
Exactly.
And now with these new orders, that whole landscape is shifting.
Yeah, and the potential consequences are pretty significant.
Oh, absolutely.
For example, one of the rescinded orders encouraged Medicare to test a $2 copay for generic drugs.
Right.
Can you imagine? Think about somebody who is managing a chronic condition.
Yeah.
That kind of change could have made a world of difference for them.
Absolutely. It raises the question of what happens to those costs now.
Right.
And it goes beyond just prescriptions.
Yeah.
We're also seeing potential changes to Medicaid.
Yeah, and a lot of people think of Medicaid as a program that only serves low-income families.
Right.
But it's so much broader than that.
It is.
It supports children, seniors, people with disabilities. It's a safety net for a huge portion of the population.
It really is. Under the Biden administration, we saw Medicaid expand to cover things like meals, housing, and even air conditioners in some cases.
Wow.
They were recognizing that these things are often interconnected with overall health.
Absolutely.
And so now there's this concern about a potential scaling back,
right,
with fewer people qualifying and benefits potentially being reduced.
Yeah, before we dive deeper into some of those potential impacts,
sure,
I do want to remind everybody that if you are finding this information valuable, please hit that subscribe button to stay updated on future episodes where we're going to be unpacking all of this and more.
Definitely.
But, okay, let's talk about the Affordable Care Act for a second.
Okay.
Under the Biden administration, we saw those record enrollments I mentioned. And that was in part thanks to those longer sign-up periods.
Yeah.
But with these new orders, there's the potential for shorter enrollment windows and tighter eligibility requirements.
Absolutely.
So what does all of this actually mean for the average person? The person who's just trying to navigate the healthcare system. Imagine you're a family and you're trying to secure coverage, but you're doing it during this really limited enrollment window. How stressful would that be?
It would be incredibly stressful. It adds a whole layer of complexity, especially for people who might be newly eligible or people who are experiencing life changes that require them to seek coverage outside of the standard open enrollment period.
Exactly.
Yeah.
This is a lot to think about.
Yeah.
We're going to continue to explore these potential impacts, but first we wanted to turn our attention to a topic that hits everybody's wallet, and that is prescription drug costs.
Oh.
And on this one, we actually want to hear from you.
Yeah. What do you think?
Think about the last time that you were surprised by the cost of a prescription. Now, just imagine those costs going even higher.
Yeah.
What kind of impact would that have on your life?
Absolutely.
Share your thoughts in the comments below.
Right.
We really would love to hear your perspectives. And while you're down there, if you're finding this conversation helpful, please give this video a like.
Right.
It helps more people find this really important information.
Definitely. It's a crucial question, and especially because under the Biden administration, there was such a big push to try to lower drug costs, particularly through that Medicare drug price negotiation program.
That was a big one. That was a game changer.
It was.
But now there's uncertainty about the future of that.
There is. There's definitely a shift in approach.
Right.
And while the details are still kind of unfolding, it does raise some concerns about what this means for Medicare's negotiating power and the potential for drug prices to rise.
And that actually brings us to another really important point, and that is how these policy shifts don't just impact the people who are directly enrolled in government programs.
Right.
The ripple effects can actually reach everyone.
They do.
Even folks with private insurance.
Yeah, think about it this way. Imagine a scenario where more and more people become uninsured.
Okay.
What happens?
Yeah.
Hospitals and clinics still need to cover their costs.
Right.
So they often end up passing those unpaid bills onto the people who do have insurance.
Right, so it's like a hidden tax.
It is. It's like a hidden tax.
On the people who are already paying for coverage.
Yeah.
So even if you're thinking, well, I'm not on Medicaid, I'm not on the ACA, so this doesn't affect me.
Right.
That's not necessarily the case.
You might.
These shifts can really impact the entire healthcare landscape,
Yeah.
which ultimately touches all of us.
It really does. We're all in this together.
Yeah, it really shows you how interconnected the whole system is.
It does. It absolutely does. And that's why it's so important for people to stay informed.
Right.
And to really understand how these policy shifts could impact them,
Yeah.
regardless of their own individual circumstances.
So let's talk about that. What can people actually do to kind of navigate this changing landscape?
Right.
Because it can feel overwhelming.
It can't. Well, you know what they say, knowledge is power.
Right.
So start by reviewing your current health insurance plan.
Okay.
I mean, with all of these potential changes, it's really crucial for people to understand, the details of their coverage, any upcoming deadlines,
Right.
potential changes to eligibility requirements.
Huh. Especially with those potential shifts to the enrollment periods that we were talking about.
Yeah, exactly. And don't overlook the power of community.
Yeah.
A lot of local organizations are working really hard to try to fill these gaps in healthcare access,
Right.
especially during times when things are uncertain.
So connect with those community health programs.
Yeah.
They can really be a lifeline for a lot of people.
They can be. They absolutely can. And remember, understanding how these policies actually work is really the first step towards being able to protect yourself and advocate for your own healthcare needs.
Now let's zoom out for a minute and think about some of the broader implications of these shifts. I think it's really easy to get caught up in those individual impacts.
Yeah.
But healthcare isn't just a personal issue, is it?
No, it's not. I mean, it's woven into the very fabric of our society,
Right.
our economy. When people don't have access to affordable care,
Yeah.
it creates ripple effects that go way beyond just their own well-being.
It impacts their ability to work, to support their families, to contribute to their communities.
Exactly. It can create this cycle of hardship that ultimately affects us all.
Right. These policies are about more than just healthcare. They're about the health of our communities.
Yeah.
And the health of our nation as a whole.
And that's exactly why these conversations are so important.
Right.
We need to be aware of the potential consequences, both individually and collectively, so that we can make informed decisions and advocate for policies that actually support the well-being of everyone.
Before we wrap up, we really do want to hear from you.
We do.
What aspect of these healthcare policy changes concerns you the most? And tell us why. Share your thoughts in the comments below.
Yeah.
Let's keep this conversation going.
We want to hear from you. And, if you found this discussion helpful at all, give it a like.
Yeah.
And share it with somebody else who might also benefit from this information. Engaging in these discussions is so important to shaping a future where everyone has access to the health care that they need.
Healthcare is constantly evolving.
It is.
So it's so important for everybody to stay informed and engaged. We've covered a lot of ground today,
We have.
but this is really just the beginning of the conversation.
It is. There's always more to learn and explore.
Always.
We encourage you to keep digging deeper, stay curious, and most importantly, stay informed.
Yeah. It can feel daunting at times,
It can.
but it's also really empowering to remember that our voices do matter.
Absolutely.
Staying informed, engaging with our communities, advocating for our healthcare needs. These are all really powerful ways to make a difference.
Absolutely. We can't just sit back and be passive observers.
Right.
We have a responsibility to be active participants
Yeah.
in shaping the future of healthcare, both for ourselves and for our communities.
I think that's a really good point.
Yeah.
We've explored a lot in this episode,
Yeah, we have.
but we've only really scratched the surface.
That's true.
And we hope that this has been a valuable starting point for everyone out there listening
Yeah.
to dive deeper into these really complex issues.
And before we go, if you enjoyed this episode and found it helpful at all,
Yeah.
hit that subscribe button to stay up to date on future conversations.
Yes.
And don't forget to leave a like.
Right.
It really does help more people find this important information.
Absolutely. Well, thanks for joining us today.
Yeah, thanks for having me.
We hope this conversation has kind of empowered you to navigate all these healthcare changes and to make your voice heard.
Yes, remember, knowledge is power.
Yeah.
The more we understand about these issues, the better equipped we are to advocate for ourselves and our communities.
Thanks for listening.